Good evening, everybody. As Jan said, my name is Rob Signorello. I am the rehab supervisor for physical, occupational, and speech therapy over at the Davis Therapy Centers at Boca Hospital. Tonight, I think what I'd like to discuss, kind of follow up a little bit on Dr. Levin, but talk a lot about prevention. A lot of people had questions about specific injuries and stretching, and kind of got a feel for what everybody was thinking about that come in due to various itises and sprains and strains and all of that stuff. For really, probably the major reason is poor technique. People, we see it a lot around the new year when everybody decides to go back and exercise and lose all their weight and get fit and everything. And most people go back and do too much too fast. The beauty of being in a facility like this, one, having excellent equipment, two, having excellent professionals to help you work out, whether it's personal trainer or therapist or whatever, makes a big difference because honestly, a lot of people, lay people, don't know how to exercise properly. And it's not usually one particular event that happens. It's a buildup of poor technique. It's a buildup of poor posture. It's a buildup of poor mechanics that after 5, 6, 7 weeks of exercising, your joints or one particular joint begins to fail. The inflammatory process begins, like Dr. Levin talked about. You start to develop tendinitis or a strain or something of that sort, and then you have to stop doing your activity, okay? And then you become weak, your muscles will atrophy, you go through this whole cycle of inflammatory process, pain, etc., and you're kind of in this nasty little hole, black hole of I can't work out, I can't do anything, my muscles hurt, my joints hurt, whatever, and what do I do? And we see that very commonly in the clinic from either exercise, people that have said, you know, I just started playing tennis last week or golf or doing Pilates or a particular type of exercise. And if you're not properly, let me rephrase that, if your body is not properly trained to perform that activity, you're going to set yourself up in the long run, whether it's weeks, months, for some type of failure where you're going to have to stop that exercises. You had mentioned stretching. Is stretching okay? Stretching has been in our field in orthopedics when we were at FAU, one of the most controversial things to talk about. When is it right to stretch? Okay, what type of stretching should I do? Should I warm up before? Should I stretch before? Should I stretch after? Should I do both? Okay, you could read 10 different articles and probably get 10 different opinions from different clinicians, doctors, physical therapists. But what's been true to form in the last few years is, just as Dr. Levin had said, it's never good to cold stretch. Okay, I see a lot of people that work out at Gold's Gym or on their own, and they feel like they've just walked into the gym and they start doing, you know, all their upper body stretches. They start doing their flexing forward, and they haven't done anything to prepare themselves to stretch. Okay, stretching is a twofold thing. One, you're elongating the muscle fibers that you have, okay, and you're stretching not only the muscle, like let's say your bicep or your quad or your hamstring, you're also stretching the tendon, okay? Well, within the muscle fiber, if you remember Dr. Levin's slide, was like a red color, okay? It's a red color for a reason. It's got a blood supply, okay? Blood goes to that muscle and provides it oxygen, nutrients, the things it needs to heal, to work, etc. If you stretch a muscle cold, there's usually not a lot of blood supply or not increased blood flow to that muscle. So what you really want to do is, like Dr. Levin said, you want to get on the bike, do jumping jacks, take a brisk walk, get on the treadmill, the elliptical, okay? Not as your cardiovascular exercise, but as a 5, 6, 7-minute warm-up. Get off of that and then stretch, because as your muscles have increased their blood flow, they will then become more pliable and you'll get a better stretch. So it's always good to warm up, and I tell patients this all the time, you know, how do I warm up on the golf course? How do I warm up on the tennis court? How do I warm up, you know, when I'm not in a gym type setting? there's a lot of things that you can do. You don't have to have special equipment. You don't need to do anything outrageously aggressive in terms of getting your heart rate up. You just need to do something for about 5 to 8 minutes to get your heart rate up. Again, when I work out, I do jumping jacks. As silly as it looks and as simple as it may be, it's easy, it's quick, it gets my heart rate up, and I can feel a much better stretch after I do that type of activity. So when you're on the tennis court, brisk walk, a little jog maybe, golf course the same thing, and then go into a particular group of stretches that might be effective for you. Then the question comes into warm-up for a particular activity, whether you're working out, playing tennis, golf, etc. It's always good as well to prepare yourself for that activity, meaning you've done a pre-warm-up, you've stretched, and now you want to begin your activity. Okay, let's say you're going to start playing tennis. Okay? I don't know many folks that play golf that won't take 6 to 12 to 20 practice swings before they get on the first tee. Or they go out on the tennis court and they won't do anything and just start playing competitively with their partner. Okay? You're going to volley. You're going to take a couple practice, maybe go out on the driving range. You go into the gym. Instead of going right to the bench press or to the fly and put on the maximum amount of weight you can put on, you may put on half of the weight or a quarter of the weight and do 5, 6, 7, maybe 10 reps at a very light weight just to get your body accommodated to that activity. It's very important that people do that, okay? Because if you don't do that, again, you're going to set your body up and your joints up for failure in terms of itises and sprains and strains, okay? So you've got the pre-stretch warm-up, you've got the stretch, you've got the warm-up, then you can get into your activity, okay? Question always comes up, should I stretch after? My opinion is, why not? You're already warmed up, your body is at its maximum in terms of blood flow, heart rate, etc. Take a couple minutes and do some what I call preventative stretching. If you have problems with your back, do a series of back stretches that might work for you, or your hamstrings or calf muscle. There's a lot of different things you can do, but pre-stretching and post-stretching for exercise, whether, again, it's tennis, golf, working out in the gym, swimming, whatever, is always beneficial to do. You can do a more effective stretch by holding for 30 seconds to a minute in terms of a stretch hold and doing 1 to 2 reps of that stretch than doing 20 repetitions at 5 to 10 seconds. Okay? The longer the stretch in terms of how much you hold, usually the more beneficial it is because you are allowing the muscle fibers to really get a true stretch. Okay? There's some controversy out in the clinical world about that longer stretching can promote or predispose you to injury. I don't believe that. I think if you hold your stretch for a long time, then you're going to get a good effective stretch and it's going to help you.